This location is crazy. Parents protest planned opioid treatment center near Lynnwood Youth Club. It's right next to a Boys and Girls Club. It's literally like next door to a Boys and Girls Club. Let's see. We got a little drug use, and then we're going to send our kids to after school events. I mean, it's unacceptable to me. And this isn't so much a not in my backyard. It's a bad idea to have a hardcore. This is an opioid. This isn't, chick shadle trying to quit smoking deal. These are people addicted to opioids. These are people on the fentanyl. They're on heroin. They're on the hard stuff, right? They're on literally the hard, what we grew up knowing to be the hard drugs, not weed, not weed, but stuff that people end their lives with oftentimes. So what's going on here? Well, you got a facility that's in Bothell, which is a suburb to the north of where I am here. And then you've got a suburb to the north and west of there called Lynnwood. This one of the United States' biggest opioid treatment centers wants to move. And they unfortunately picked a space right next to the Boys and Girls Club. Terrible, terrible location. Let's jump on in. Let's see what the deal is. On our ReasonableTV.com subscription service, not only do we have content that you won't find anywhere else, we've also got the latest episode that we release. We release 2 a day, Monday through Friday, 1 on Saturday and 1 on Sunday. Got that content in the same spot. You've also got the latest news of kind of what's going on. So you've got a bunch of different content here, all organized, all right there, $10 a month. Check it out. Acadia Health tried to clear its final hurdle for approval to open its opioid treatment clinic just steps away from the Alderwood Boys and Girls Club. There's never a great place for this, right? Except maybe an island out in the middle of the ocean, but then you got to get people there and back, and you want people to get the help that they need. So you don't want to make it so far out of wherever they need to go to get there. I get that. You want to make access easy, but maybe don't put it next to a school. Don't put it next to anything to do with kids. Don't put it next to a church. Don't put it next to a museum. How about that? I don't know. Just use your common sense. This is not a common sense idea. If you were to look on a map, if you were to look at all the places that you could put an opioid treatment center, right next to a Boys and Girls Club is probably the last place you should be putting an opioid, rehab center. That's just my thought. Yeah, it's wild. Who decided? Who looked at the map? Which real estate broker seriously sat down and said, "Okay, so you guys need some space. You guys want to move your facility from Bothell to Lynnwood. Here's what we're going to do. We're going to do a big radius search." This is literally what you do as a real estate broker. All right. So we're going to look at all the space that's out there. Now you got this one, you got this one, you got this one. Somebody knew right off the bat that this location is next to the Boys and Girls Club. Somebody knew that. Somebody had that as their criteria. All right. Is there anything people might object? And you know what they did? They just said, well, let's move forward with this. We'll see if anybody objects. And if they do, legally, there's not much they can do. This is a state facility. This is a state approved, whatever. We can probably just, cram it down their throats and maybe we'll just make it happen. That's literally kind of where we're at. And the main hearing they had for this, one of the final hearings they have to overcome the hurdle, was on January 29th, a couple of days before the New Year's. It's in that dead week in between Christmas and New Year's. Well, I don't know about you, but were you doing much serious? You were probably at work. Maybe you're at home. Maybe you're retired. Good for you. But were you doing a lot of really constructive things that week? No, that's kind of a dead week, isn't it? I kind of come in here, I record some podcasts, but there's not a lot going on, during that week. And there's not supposed to be. It's like, you're basking in the afterglow of Christmas and you're wondering what the new year might bring. You're getting up early and you're studiously writing down what your New Year's goals are going to be, right? That's what I didn't do that either. Yeah. Goals. Oh, you make goals throughout the year. New Year. Those are goals that are meant to be broken by Martin Luther King Day, right? Yeah, that's reality. A contentious debate in Lynnwood reached a stalemate Monday night over the planned location for an addiction treatment center. Despite pushback from concerned residents, Acadia Health attempted to clear its final hurdle for approval to open its opioid treatment clinic just steps away from the Alderwood Boys and Girls Club, an after-school program for kids and teens. My kids spent a lot of time at the Bellevue Boys and Girls Club, mainly playing basketball. But we had some other, camps and clinics in there. We were always at the Boys and Girls Club. Like on Saturday morning, we'd be there for several hours because both my boys played basketball. Great times. Those are great times. You have all the kids running around, and you'd go there for practice. You know what we didn't think about during all that time is people with opioid addictions in the building next door. Yeah, it just wasn't a concern. Because here in Bellevue, that would have been a no-go. Maybe in your community be a no-go too. But in Lynnwood, Lynnwood's got part of Highway 99, which anything goes. It's further down south that you're seeing all the activity on Highway 99 on the YouTube channels because all the young ladies are being brought up from California and they're basically being human trafficked on Highway 99 in Seattle. But that's a whole nother story. We're talking further north in Lynnwood. There are some areas of Highway 99, which we're going to talk about. When I think it's a commissioner in the storyline, he's like, I think we should just put the opioid addiction clinic next in a light industrial area on Highway 99. And I was kind of thinking, he's going to get a little kickback for that. But it makes sense because who can handle themselves is people working in a light industrial area. Maybe they're machine shop, tire shop, whatever. They're adults. They're fully formed adults that can handle themselves. If some nut jock comes up, either tweaking out or detoxing or whatever it is, don't get me wrong. I think these people need help and they need a place to go. Just not right next door to the Boys and Girls Club. I mean, let's work it through. As a real estate broker, I would have said as a commercial real estate broker, which I am also as well, managing broker, part of the CBA, which is Commercial Brokers Association here in Seattle, whatever. As a commercial broker, as representing somebody on a commercial deal, which I rarely, if ever, do. I represent myself on office space and stuff, but mainly like that. Would I have sat down and said, what, here's a small issue you might have with this location. No, I would have said, keep looking. That's a hard no-go for me. That's a hard no-go because it just doesn't make any sense. It doesn't make any sense. And it ends up with the community getting all upset, rightfully so, because their kids shouldn't be put, would they put this next to a school? Hell no. No, they wouldn't, right? So why are they doing it next to the Boys and Girls Club? Yeah, because they can. Although Snohomish County makes up only 10% of the state's population, county data shows that they now account for more than 18% of the heroin-related deaths statewide. I think that should say opioid-related deaths statewide. Not calling you out, King 5, but I believe later in the story I heard opioid, and that makes more sense because heroin, I don't know how many people are dying of heroin, but it's not very much anymore. It's all fentanyl, right? It's all these synthetic opioids. As such, company Acadia Health said drug addiction clinics are badly needed in Lynnwood. They are badly needed everywhere. And I talk about that all the time. You need more of them because you've got so many people addicted to this stuff. And so many of the people, vast majority of the people in the encampments that you see, yeah, they're addicted to some kind of opioids because they're that addictive. They need a place to go, just not next to the Boys and Girls Club. Still, protesters at Monday night's Lynnwood City Council meeting said that they are more concerned about location than anything else. I feel like this location is crazy, said one public commenter on the podium. Safety, Zhao Ho, a protester, told King 5, yeah, the safety is our priority. It's the wrong location because it's too close to our kids. So we've got Seattle Public Schools. My last podcast was Seattle Public Schools is suing Facebook, TikTok, YouTube, all these major social media companies. They're blaming the kids for having mental health issues. Over the last few years, they're saying that algorithms that these big social media companies put together create a situation where kids watch too much social media and then they feel bad about themselves and it's affecting their mental health. Well, that's probably true. But what kind of an impact do you think an opioid clinic has next door to the Boys and Girls Club? That can't be positive either, right? You don't see anybody suing for that, do you? No. Acadia Health is one of Snohomish County's. Snohomish County is the county just to the north of me in King County. Snohomish County's largest treatment centers. On January 23rd, it plans to relocate its Bothell facility to Lynnwood, kind of side by kitty corner cities. How about that? If it receives final approval from the state, the center would host an estimated 300 patients, and it would be one of the few local clinics that administers methadone, a medication for opioid dependence. So think methadone clinic. What comes to mind when you think methadone clinic? Let me know in the comments. What I think of is people who need a lot of help, that are strung out, that are coming in to get their fix so that they don't go on the real stuff, right? And they may or may not be in a good place. You don't know, but they're coming in. I mean, it's like any kind of drug treatment facility. You're going to have folks that, maybe don't have children at the highest priority list as far as safety goes on their agenda as they're coming into the clinic. Vivian Dong, another protester in Lynnwood local, said she feels that she and other parents are being unfairly judged for being opposed to its location. Because people are saying, well, you don't want the clinic? Don't you want people to get off the drugs? And they're saying, well, we do want people to get off the drugs, just not next to the Boys and Girls Club. And I think that's fair. I really do. I think that's fair. We're in this position of either being called NIMBYs, which is not in my backyard. And, you just don't have a heart. You don't want to help people, or we stand up and try to protect our community. And we want to know who's accountable for this, Dong said. And we are glad that the city council is apparently on our side and wants to work with us. Council members expressed agreement with the concerned parents' perspectives. George Hurst, Lynnwood City Council president, told King 5, "This is just the wrong place for it." George, I agree. I'm with you, George. If Lynnwood wants one or will have one, and I think they should be, I'm thinking along Highway 99 in a light industrial area. 100% agreed. I mean, they probably used to go to that area to get the stuff in the first place, right? Now you're going to send them back in there to, get treatment. All right. Not ideal, but none of this is. So, you got to make a decision somewhere, maybe just not right next to a facility dedicated to the betterment of children. The city council, however, said that by state law, there is nothing they can do to stop it from debuting at that site. King 5 reached out to the State Department of Health Monday, and a spokesperson said that a final decision on licensing is yet to be made. So they are really far down the process on this, right? They do not have many other hurdles to overcome. What's interesting is that when the meeting was initially supposed to happen, I think January 5th, and December 5th, and then I got kicked out to December 29th. They know not a lot of people are going to go to that hearing. They know not a lot of people are going to object, because they're buying Christmas presents out the wazoo, right? I mean, they're just, I got to get little Johnny a whatever it is favorite. I'm so far removed from buying my kids gifts like that I don't even remember what that's like anymore. I go to Walmart or I go to Target, and they have those sections, and you can see it on my Instagram. They have those sections of big remote control toys, stacked up in big piles right in the middle of the aisle. I go in for the biggest, best ones of that and buy all my cousin's kids those. 5 of them straight up out the door we go. Was it 5 this year? Yeah, it was 5 this year. Takes up the entire back end of my Jeep, whatever it is. And I feel good about that. Some solid consumerism. The kids rip open these gifts at Christmas. They're excited. The parents got to scramble to get the batteries in the car and get them going, because otherwise, the kids are just going to have a meltdown. Where's my car? This year, I think I did 3 SUVs, 4x4 SUVs, and a couple of dragsters. Solid stuff. That's just Christmas, right? But when I was doing that was about December 20. No, it was after that. December 29th, I was prepping for New Year's Eve, right? As other families were. I just want to make sure that everybody has a say in this and that everybody has input on a community relations plan, Dong said. That seems fair. An Acadia representative told King 5 that he was prepared to provide updated community relations plans to the governing body on Monday, but said the opposing council did not ever invite him up to speak. He left after they moved on to the next agenda item. Acadia Health previously addressed safety concerns by saying it hires security guards if needed. And you know what? I think the story goes is that there has not historically been a ton of issues at these locations because these are people that have already gone through the detox. These are people that are looking to better themselves. They are looking to, make something better out of their lives. Unlike so many people you hear interviewed in the encampments, right? So these are not those people. These are people trying to get their together, for lack of a better term. But again, I don't, if there's any which way chance a problem's going to happen, I'd rather not have kids around to see that. That is just my thought. Machine shop, tire shop, stereo shop, used car sales. Those folks can work it out. All right. You got somebody strung out that needs to get their methadone shot. All right. Okay. Yeah. All right. Well, that makes sense. You don't have some little kid being impacted by that. That's the way I see it. That's as a real estate broker, as a commercial broker. That's kind of the way I would view it is this is probably not the greatest call in the commercial sphere for space. All right. That's my opinion for what it's worth. Thanks so much for listening. Thanks so much for being a part. We'll catch up soon on the next one. Bye for now.